Hi, I'm Dr. Dean Mitchell. If you think you are suffering from Candida, my new book, Conquering Candida, is the book for you. For the first time in over 50 years, a medical doctor, myself, has written a book bringing the latest scientific advances in understanding and treating Candida. Previously, there was a very popular book called The Yeast Connection by Dr. William Crook, which discussed Candida and has been a classic in the field. But I hope with my book, I'm bringing the latest scientific evidence that will help you treat your Candida. So let's get into it right away. Chapter 1 is titled Candida Confusion. And in this chapter, I discuss why, for decades, doctors didn't believe that Candida overgrowth was real. They considered it a made-up diagnosis, and they would shame the patients and definitely not treat the patients. The chapter opens with a really riveting case of a patient I saw that traveled all the way from New Mexico to see me. It was a young woman who was struggling with Candida all over her body. Welcome back to the video series on my book, Conquering Candida. Today we're going to talk about the first chapter, which is Candida Confusion. I open with an interesting quote. You can always recognize the pioneers by the arrows sticking out of their backs. And what that really means, like from the cartoons, that a lot of times when you're the person trying to break new ground, you get a lot of opposition and a lot of pushback. Now, as I mentioned in the introduction, that I had a really fascinating case of a woman I called Erica. She had traveled all the way from New Mexico to see me in New York City. Erica had had severe chronic Candida vaginitis. She had oral thrush. She had fungal discharge from her eyes and her breasts. Her doctors couldn't figure out what was going on. They tested her for AIDS, and that was negative. They tested her for immune deficiency. That was negative. Her doctors almost didn't believe that Candida could be causing all of these symptoms, even though these other tests were negative. I treated Erica successfully with my protocol that I'll be discussing in a later video, with vitamins and strong antifungal medications and changes to her diet. You know, there's some important history about Candida. As I mentioned in the opening series, Dr. William Crook, an allergist in the 1960s, was one of the first ones to recognize this condition. He saw it happening in women, but also in men. You know, the patients had symptoms of bloating, constipation. They were having rashes, hives, chronic sinus infections, brain fog, and fatigue. Now, Dr. Crook, despite helping so many patients, was faced with an abundance of resistance, and in fact was really discarded from the medical community. It took many years, and now some of the latest research, for people to believe that Candida is a real diagnosis. What I want to say is I understand why there's been so much confusion around Candida. We'll get into how the diagnostic testing is not great, and it really relies on a very experienced clinician. And that's what we're going to be discussing in the upcoming videos. Please, if you like this video, go to our YouTube channel, The Smartest Doctor in the Room, and hit subscribe.